Bonjour, Mino Gajeb, Kinawia, Bejikini Buwe Dijnakaz, Mong and Dodem, Kikonong, Ajordana and Dunjaba. This is Monday, January 18th, 2020, doing a check-in update in regards to COVID-19 here at the Chippewas of Kellan Stony Point First Nation. There's currently four active cases of COVID-19 here, both on and off reserve that have been tested and accounted for here in the First Nation. We are aware that there are other community members that don't live here, weren't tested here, that are positive and are hopefully at home isolating and monitoring themselves. So that's the current numbers. I want to take a minute to acknowledge the families in the community here that are experiencing a loss right now and send my thoughts in regards to them. And I've been assured by Pastor Murray that during the funeral services for the late Keith Brissett that COVID protocols will be in place and that there will be a COVID-safe visitation that takes place. So the community can rest assured that the Victorious Faith Church is taking precautions around that, and protocols are in place. In regards to COVID here in the community, a lot of information out there about and phone calls coming into the health center about people that are positive or contacts that are moving around and visiting. And I just want to encourage community that if you have symptoms, whether it's a cold, a flu, whether you think it's anything like that, or if you were in contact with a COVID-19 person, to stay home, to isolate, to shelter in place and keeping the community safe. I've been asked by the health center staff to talk a little bit about the incubation period and when it is the best time to get tested. So if you've been in contact with a person that has tested positive for COVID-19, the best time to get tested is between 5 and 7 days within being in contact. If you're tested prior to 5 days, there's a high probability, a very high percentage of a chance that you will get a false negative. And the current protocols are, if you've been in contact with a positive case, you're to isolate for 14 days. If you do test positive, of course, public health will tell you that 10 days from your positive test, you're deemed to have moved beyond it. But if you're symptomatic, you're asked to isolate until the symptoms subside. So that's a little bit around the testing. If you do need a test, again, if you were in contact with somebody that tested positive, or if you're symptomatic, begin isolation immediately. And then call the health center at 519-786-5647 and request for yourself to come in and be tested. But if you test too soon, keep in mind it can result in a false negative, which can increase the spread. If you are a positive case, or you have a positive case in your household, there's already a high probability that you've exposed each other to it. But if there is a need for isolation, the isolation center is being redeployed here at the First Nation for resources in that. If you need to access the isolation center, again, that number applies, 519-786-5647. We'll be able to help you get into the isolation center. But we're encouraging you right now to shelter in place. If you need help with meals, if you need a nurse to check in on you and do symptom management, again, the same number applies. Give them a call. We'll be there to help you. We're all on this together, and numbers are climbing. 4 cases does not seem like a lot, but it is a lot, because each of those 4 people could have been in contact with other people, and it spreads rapidly in the community. So I'm just encouraging everybody to do your part and make sure you're taking care of your responsibilities. There's no need to be afraid of this virus. Respect what's going on out there. Do your part, and let's stay positive in this. Let's stay positive while keeping ourselves negative from the virus. A little message from the fire department. We've been getting a number of calls asking for fire trucks to take part in birthday parades and things like that. That comes at a heavy cost of human resources and financial costs, because each time the truck goes out, there's a cleaning protocol that must be done to make sure that the truck is sanitized and prepared and ready to go in case of an emergency, a fire-based emergency or a medical emergency. So at this time, the fire department respectfully asks that they're not being contacted to support the birthday parades. It's just too much of an ask right now in terms of COVID-19. And to add to that, there is a stay-at-home order out there, essential travel only, and we're going to do whatever we can to try and stop the spread. So I understand people are lonely out there and mental health becomes an issue, and you want to be in contact. And birthday parades are a great idea of keeping ourselves separate, but the fire department, for example, has expressed that they're not able to support those requests at this time. That's it for my check-in today. Stay safe out there, everybody. Do your part. Stay home. Stay home, stay safe. Do what you gotta do to keep the community safe. Mio Manik, Eja Gagigo Young.